Hello everyone, my name is Herman Walker. I'm a student nurse at Indiana State University in the nursing program. I'm taking nursing 444 called Community Health Nursing. Today we're gonna talk about heart attack risk factor and education. Yeah, we're going to have some learning objective. The participant will be able to define what is a heart attack. The participant will be able to know the leading cause of heart attack, and the participant will be able to know the risk factor of heart attack. The participant will be able to know the sign and symptom of heart attack. And number 5, the participant will be able to know how to prevent heart attack. Please take a few minutes to test your knowledge by following the link below, the link that we have there. Just click on the link and you can take some tests regarding heart attack. Before we start, it's very important for us to know what is heart attack. A heart attack, also called myocardial infarction, happens when a part of the heart muscle doesn't get enough blood. The more time that passes without treatment to restore blood flow, the greater the damage can happen to the heart muscle. What are the causes of heart attack? The leading cause of heart attack is coronary artery diseases, which is caused by plaque buildup in the wall of the artery that supply blood to the heart. The plaque is made up of cholesterol deposit. Plaque buildup causes the inside of the artery to narrow over time. This process is called arteriosclerosis. On the image here, we have the normal artery, and on the other side, we have a narrowing of artery, and the narrow artery is caused by lipid deposit of plaque. And less common cause of heart attack we have severe spasm. We have sudden contraction of a coronary artery that can stop blood flow to the heart muscle. Sign and symptom of heart attack. Chest pain or discomfort. Most heart attack involve discomfort in the center or left side of the chest that lasts for more than a few minutes or that go away and come back. The discomfort can feel like uncomfortable pressure, squeezing, fullness, or pain. You are feeling weak, like headache or faint. You can also break out into a cold sweat. You have pain or discomfort in the jaw, neck, or back. You have another pain or discomfort in one or both arms or shoulders. You have shortness of breath. This often comes along with chest discomfort, but shortness of breath also can happen before chest discomfort. And then the last one, we have dizziness and nausea. As you can see in this graphic, it's important to know that women and men can have a symptom of heart attack differently. In men, we can have sweating, pain in chest, arm, neck, and jaw, shortness of breath, heartburn, or indigestion. In women, they can have dizziness, uncomfortable pain between shoulder blades, shortness of breath, indigestion or gas-like pain, unexplained fatigue, and sleep disturbance. So it is very important when you have to make sure when you're taking care of someone with heart attack, you have to make sure to differentiate if it's a man or a woman because the signs and symptoms are different. And the risk factor of a heart attack. The modifiable risk factors are those that an individual can reverse with lifestyle changes. We have being overweight or obese, smoking, eating a diet high in fat and or sugar, leading a sedentary lifestyle, high blood pressure, high large density lipoprotein, which is the bad cholesterol, and a high blood sugar. The non-modifiable risk factor we have family history and genetic, and you have ethnicity as well, and then we have age and sex. It is important to know that the older you get, the heart attack can happen at every age. But you have to understand that the older you get, the more likely you're going to be having suffering from heart attack or heart diseases. Also, it's also important to point out that the most affected are Alaska Native American, African American, white, American Indian, and then the less affected are Asian American and Hispanic American. The heart attack prevention tips. It's important to eat more fruit, veggie, and grains. Take time for regular relaxation. You have to stop smoking, drinking alcohol. You have to control your blood pressure. You have to reduce your sodium. You have to have saturated fat and added sugar. Reduce your sodium, saturated fat, and added sugar. You have to make sure you have exercise. You have to exercise at least every 30 minutes, at least 30 minutes, 3 times a week. What to do during heart attack event? If you notice the symptom of a heart attack in yourself or someone else, the first thing that you do, you call 911 immediately. The sooner you get to an emergency room, the sooner you can get treatment to reduce the amount of damage to the heart muscle at the hospital. Healthcare professionals can run tests to find out if a heart attack is happening and decide the best treatment. In some cases, a heart attack requires a cardiopulmonary resuscitation or an electrical shock defibrillation to the heart to get the heart pumping again. Bystander trained to use CPR or defibrillator may be able to help until emergency medical personnel arrive. Remember, the chance of surviving a heart attack are better the sooner emergency treatment begins. So that's really one of the reasons that it's very important that you take some CPR class because you never know what could happen. Please, if you want to have more information on heart attack, make sure you follow the Mayo Clinic link below, or you can follow the heart.org below as well to get more information. Please take a few minutes to test your knowledge by taking this post test. There you have a link below where you can go and take the post quiz, and then after that you can come back and check the answer for the pre and the post test. Thank you. For this video presentation, and there's a say I have my references here. I use the Center Diseases Control and Prevention, and then as well I use my nursing book to do this assignment. Thank you for your attendance.